Okay, let's dive into a real medical mystery. Today, we're unpacking how Lyme disease operates, and honestly, it's less like your standard infection and way more like a highly coordinated biological heist. When we normally think of bacteria, we picture these straightforward invaders, right? They crash into our systems, cause a bunch of obvious damage, and set off all our biological alarms. But the pathogen we're looking at in this explainer is a total master of disguise, stealth, and evasion.
We've got to start by clearing the name of Lyme, Connecticut. Back in the 1970s, it unfairly took the historical blame for a pathogen that literally exists worldwide. It was actually the sharp observations of two local moms, a doctor and public health officials in the towns of Lyme and Old Lyme, that finally brought this to light after a really strange outbreak of childhood arthritis. These folks deserve serious praise for describing the disease, not the infamy of having it named after their gorgeous towns. The reality is, this pathogen has been operating globally for a really long time.
So here is our briefing dossier for today's explainer. We're going to cover 1. The unfair origin story. 2. Ticks, the stealthy accomplice. 3. The shape-shifting bacterial mastermind. 4. Evading the immune system. And finally, 5. Symptoms and diagnostic challenges. Let's get right into it.
Section 1. The unfair origin story.
Okay, so within a few days of infiltration, your immune system tries to catch up, and it often creates this really distinctive bullseye rash. Technically, it's called erythema migrans, which literally translates to moving redness. It's that solid red inner circle surrounded by clear skin and then another red ring. But here's what's totally fascinating. This rash isn't actually damage caused directly by the bacteria itself. It's literally the visual footprint of your own innate immune system aggressively trying to capture the invaders. But as we'll see, the perpetrators have already planned their escape. Oh, and to make things even trickier, not everyone actually gets this distinctive rash.
Moving on to Section 2, Ticks, the stealthy accomplice. This accomplice builds its infiltration skills across 3 life stages. Basically, think of them as toddlers, teenagers, and adults. And they don't fly. Instead, they do this thing called questing. They hang onto a blade of grass with their hind legs, waving these barbed front legs in the air, just waiting for an unsuspecting host to brush by. Now, a larva actually hatches completely uninfected, because the bacteria just can't survive the winter inside the tick's eggs. But the moment that larva takes its very first blood meal from an infected mouse, boom, it picks up the pathogen. It holds on to those bacteria when it molts into a nymph, and it's actually that nymph stage, or the later adult stage, that infects the next host. When these ticks hitch rides on large, roaming animals like white-tailed deer, they massively expand their geographic territory.
You just have to marvel at this infiltration toolkit. Unlike a mosquito that's in and out in seconds, a tick actually needs several days to get its blood meal. To survive that long completely undetected, it uses an incredible arsenal. First, it injects a local anesthetic, so you feel absolutely zero pain. Then, it uses anticoagulants to stop your blood from clotting. It anchors itself with firm barbs, and, perhaps most wildly, it actively suppresses your localized immune response. I mean, think about getting a tiny wood splinter, right? Within a day, it's red, it's swollen, it hurts. The tick completely bypasses that inflammatory response. This perfectly rolls out the red carpet for any bacteria it happens to be carrying.
But the crucial point here is that this bacteria actually wants a peaceful coexistence. In its preferred primary host, like a white-footed mouse or a chipmunk, the bacteria gently modulates the animal's immune system just enough to replicate without causing any sickness at all. I mean, a good parasite doesn't want to damage its ride. But us humans, we are what's called a dead-end host. When the bacteria accidentally gets dropped into a human, our immune system reacts totally differently, and honestly, all biological hell breaks loose. The bacteria can't even reach high enough numbers in our blood to be transmitted to another tick, which makes the human body this chaotic, accidental battleground.
All right, Section 3, the shape-shifting bacterial mastermind. Meet Borrelia burgdorferi. It was discovered in 1982 by Willy Burgdorfer, and let me tell you, this is not your standard round or rod-shaped bacterium. It's a spirochete. That means it has this bizarre corkscrew shape. Normal bacteria usually have little external hairs, called flagella, to help them swim. But Borrelia, it possesses internal flagella that run entirely up the inside of the organism. This unique internal motor gives it the sheer power and rapid corkscrew speed to easily outrun and outmaneuver our large, kind of cumbersome immune cells like neutrophils and macrophages. But speed definitely isn't its only trick. It completely lacks lipopolysaccharide, or LPS. Think of LPS as the universal uniform that our bodies look for on most standard bacteria. Since it's not wearing the uniform, our usual detection alarms just don't ring. Plus, its genetic makeup is highly fragmented into over 20 variable DNA plasmids, which creates a myriad of different strains. And incredibly, it lacks the enzymes needed to recycle its own cell wall components. So instead, it just casts off fragments called peptidoglycan directly into our bloodstream. This cellular trash acts exactly like decoy flares. It intensely distracts and provokes our immune system into attacking the debris, while the actual bacteria just quietly slips away.
Which brings us to Section 4, Evading the Immune System.
As researchers have noted, disguise is another weapon the organism is very good at, mixing and matching genetic material to give many combinations. It relies heavily on an ever-changing disguise to survive an environment that is literally designed to hunt it down and destroy it.
The depth of this cover-up is just mind-blowing. First off, the bacteria literally holds up a fake ID card. It expresses a protein called CD47. Now, this is the exact same don't eat me protein that our own normal human cells use to tell the immune system to leave them alone. Next, it binds to factor H in our blood. This acts like a pair of wire cutters to completely disable the complement system, which is our body's frontline chemical defense. And finally, the absolute masterpiece of its disguise, a gene known as VLSE. This gene allows the bacteria to constantly mix and match genetic material, effectively swapping out the lipoproteins on its outer jacket. By the time your adaptive immune system builds the perfect antibody weapon for the jacket it was wearing yesterday, the bacteria has already changed into a brand new one today. It renders your antibodies completely useless.
Let's look at Section 5, Symptoms and Diagnostic Challenges. It is absolutely vital to understand that Borrelia burgdorferi produces zero toxins of its own, and it doesn't even penetrate our cells. It just navigates between them and anchors itself to the extracellular matrix, which are those tough fibers supporting our tissues. Our own confused immune system then causes the collateral damage, and that damage entirely depends on where the bacteria anchors itself. So, if it uses the ARP protein to anchor in your joints, your immune system's frantic response causes the swelling and pain of Lyme arthritis. If it binds to decorin in the heart, the resulting inflammation disrupts electrical signals, causing Lyme carditis. If it manages to traverse into the central nervous system, you can see things like facial palsy or meningitis. The bacteria is really just sitting there. Your own immune response to it, and its cast-off debris, is what actually creates the disease symptoms.
And because of all this, confirming a diagnosis is notoriously exasperating. With a lot of infections, a lab can just take a sample, grow the bacteria in a culture, and look at it under a microscope. Well, you cannot do that with Lyme disease. The organism is in way too small a number in the blood, it simply doesn't grow in routine cultures, and it hides incredibly deep in obscure tissues. So doctors must rely entirely on hunting down specific antibodies in the blood. And as you can imagine, that is really difficult and confusing when the mastermind keeps changing its appearance. It really is the great imitator of other ailments.
This diagnostic difficulty leads us to a pretty staggering reality. While the CDC officially receives reports of about 30,000 cases annually, they actually estimate that the true number of infections is closer to 300,000 occurring each year in the United States alone. That's a massive difference. Most cases go completely undetected or unreported, making it the most common insect-borne disease in the entire country. Now, if it's caught early with that telltale rash, antibiotics like doxycycline usually cure it. But we all know life isn't always simple, and 10 to 15% of patients suffer mysterious, long-term consequences long after treatment. As we wrap up this explainer, it really leaves us pondering the sheer complexity of this microscopic deception. Between its hibernating capabilities, its decoy flares, and its constantly changing disguise, Borrelia burgdorferi is a true biological marvel. With so many patients experiencing chronic symptoms, what remaining secrets does this shape-shifting mastermind still hold that science is yet to solve? Keep wondering about that, and thank you so much for joining me for this explainer.